Justin Timberlake announced late last week that he has been diagnosed with Lyme disease. The singer posted on social media after wrapping up his tour in Turkey. And Timberlake had faced backlash for having low energy in recent performances. He says he considered ending the tour after his diagnosis, but ultimately decided to continue performing. Now we've brought on Dr. Christopher Labos to talk more about the symptoms of Lyme disease and also what you can do to protect yourself. He is an epidemiologist and cardiologist joining us this morning from Montreal. Sir, thank you for being with us.
No, thank you for having me.
So Justin Timberlake is certainly saying that this is a big problem for him. Relentlessly debilitating is what he said about it. Remind us what Lyme disease is and what it does to the human body.
Well, Lyme disease is an infection. It's a bacterial infection. It's not something that we've seen very much of in Canada. It was only identified back in the 1970s, and we've been previously spared in Canada because the ticks that carry it were generally not able to survive the Canadian winter. But if you do get bitten by a tick, it will transmit the bacteria into your body, and then that bacteria causes an infection. And while the early symptoms are pretty typical of most infections, the fever, the malaise, the weakness, if it goes untreated, then long-term, it can start affecting other body systems. It can cause an inflammation of the heart, which causes heart block, which might need a pacemaker. It can cause muscle pains. It can cause arthritis. It can cause nerve pain or nerve weakness. And so there's a lot of different organ systems that can be affected. And, the people who have the most severe forms of the infection can actually feel quite sick.
And so you mentioned there that they were not able to survive in cold Canadian, even summers, I suppose, as a result of our temperatures. But with climate change, has that changed things to a point where we're seeing an uptick?
Yeah, we are. And it's exactly because of that. Because the climate is getting milder, because the winters are getting milder, the ticks are able to lay their eggs, the eggs survive, they are able to hatch in the summer, and the ticks are able to spread. And so their natural habitat has extended north. And whereas we previously didn't see very much Lyme disease in Canada, we are seeing more of it. And we're seeing this slow creeping increase of the habitat into parts north where normally it would have been impossible before. So we are seeing more Lyme disease. The cases are still relatively small, on a global perspective, but we've gone from seeing almost none to seeing, enough that we need to talk about it and, explain to people what this is.
Keeping in mind that we're a national morning show here, are there parts of the country where people should be particularly concerned?
Well, the further south you live, the more concerning it is because it's obviously warmer further south. The further north you go, less of an issue. So if you're talking about southern Quebec, southern Ontario, anything along the U.S. border, that is a concern, particularly when you're talking about the northeastern U.S. border. You get north to parts, Yukon and Northwest Territories or Nunavut, obviously less of a concern there. So it really is a geographic variation thing. And even within the same province, where I am in Quebec, southern Quebec, you're seeing more Lyme disease, but you get into northern parts north of the island of Montreal, much less.
And I give my dog a little tick medication so that she doesn't catch it. But is there any sort of medication or vaccine for humans?
There's a vaccine for dogs. There's unfortunately no vaccine for humans. There used to be a vaccine for humans, but it was taken off the market many years ago, not because of safety concerns, but because the manufacturer found it to be unprofitable. There was some anti-vaccine talk at the time about it causing arthritis, which did not pan out scientifically. But there was such low uptake of the vaccine, the manufacturer just decided to stop making it. So it's not available. There are new vaccines under development. There are some in phase 2 trials, so we'll see if they pan out. But right now, if you're a human being, the only way to not get Lyme disease is to not get bitten by an infected tick. So wear long pants, put bug spray, and do a tick check. And if you see a tick, remove it quickly from your skin, because if the tick is not present for more than 24 hours, it won't be able to transmit the bacteria to your system.
Doctor, our top story today is about the wildfires that are burning in many parts of the country. And obviously the wildfire smoke is impacting so many people. There are so many health concerns as a result of those fires and the smoke that's filtering down into a lot of cities across the country. What's your advice for people to try to protect themselves?
If you're in an area with a poor air quality advisory, and there are many parts of that across the country, we've been getting them even here in Montreal, which is pretty far removed geographically from where the wildfires are. When it's that bad, especially if you're a high-risk individual, just stay indoors. Turn on the air conditioning so that you have the filter of your air conditioning to filter out the particles. Don't go outside and do sort of exertional things outdoors, because the air quality is not good, and you couple that with hot temperatures, that's not good for the human body.
Do we have to wear N95s, those sorts of things?
It depends how bad it is. I mean, those masks are there specifically to filter out particles like that. So it depends how bad the air quality is. It depends how long you're going to be out there. It depends what your risk is. If you're somebody with a lot of pre-existing medical conditions, it's not a terrible idea to do so. So it really depends on the situation and what the air quality is in your specific local area.
All right, Doctor, thank you so much for joining us on the program with all of these storylines that were talked about.
My pleasure. You take care.